Welcome. Um, my name is Megan Anakin Tokoingoa. I'm a member of AIPPEN's networking planning group. I'm also ANZAP's chair of scholarship and research this year, and I get to be, most importantly, your host for today's session. Before we begin, I'd like to say that AIPPEN and ANZAP acknowledge and pay respect to the traditional owners, custodians, and knowledge holders of the lands and waters across Australia on which our members live and work, and to their elders past, present, and future. AIPPEN and ANZAP acknowledge Māori as Tangata Whenua and Te Tiriti o Waitangi partners in Aotearoa, New Zealand. I invite you now to introduce yourself and make any acknowledgements you would like using the chat function of Zoom. Please ensure that your first and last name are visible on your tile. And if you're an AIPPEN member, please add IPE after your name. If you're solely an ANZAP member, please put ANZ after your name. And if you're kind of feeling like you belong to both groups, feel free to put IPE, ANZ, if you want to celebrate that you're a committed member that way. This will help us to assign a good mix of people to the breakout rooms that we're going to be using very soon in this session. I'd also like to advise you that this event is being recorded. So as always, feel free to turn off your video if you wish. However, I strongly encourage you to turn it on when you're in the breakout room. The conversations in the breakout rooms will not be recorded. We will also be using the chat function, as I've already indicated. So it's really important that if there are more than one of you sharing a screen, that you maybe put your two first names on there so we can see who that is. And once again, I really encourage you to use the chat function to post comments and questions throughout today's session, because the goal of this series of networking events is to encourage conversations among people interested in IPE. And we really want you to be exchanging ideas and practice and building your network of colleagues. So I have the great honor of introducing today's session. Next slide, please. How can we assess teamwork in interprofessional education? Our special guest today is Carl Schneider. Carl is going to reflect on his experience facilitating and assessing IPE student initiatives at the University of Sydney. His goal is to spark conversation about one of the recently revised IPEC, I love acronyms, core competencies, teamwork, and the expectation that they can adapt, students can adapt their role in a variety of contexts. So Carl is going to outline cognitive and affective skills that students are expected to demonstrate and describe an approach to assessing teamwork that's mapped to Kirkpatrick's model of training evaluation. And I know many of us are quite familiar with that. So using this background information, those of us gathered here today are going to discuss how they might use this approach to assess teamwork with students in our own IPE programs, and really spend some time thinking about the potential benefits and challenges. So I'm not certain we'll leave with answers. We might leave with more questions, but hopefully we're going to leave with a great amount of curiosity. So just before I hand over to Carl, I'd like to let you know that Carl Schneider is associate professor. He is a registered nurse and a registered pharmacist. So he's doing double duty for two professions here today, I'm very proud to say, and an academic at the University of Sydney Pharmacy School. He's got a broad range of experience across acute and community care settings, both in Australia and the United Kingdom. So he's bringing great perspectives for us, in addition to health professions education. His research interests include patient safety via collaborative quality use of medicines and health services design, implementation, and evaluation. So I think those of you who are interested in connecting with Carl, you'll be able to speak to him on many, many levels. So without further ado, and I think we've got 62 people here now, Carl, not to make you feel intimidated. I think
No, it's an
over to
absolute
you.
pleasure. Thank you so much, Megan, for the introduction, and thank you very much for the privilege of being able to chat with people that are also passionate about interprofessional education on behalf of AIPPEN and ANZPE. So I guess I probably should say that I'm talking from the perspective of a participant in this journey rather than somebody with all the answers to the questions, because this is a question that I posed to myself, because I think that we haven't yet quite cracked this one, and perhaps we can have a discussion in our small groups today, and perhaps we can take another step in that journey. So a lot of what I'm going to be talking about today, many of you here as experts and experience in interprofessional education will be familiar with. Many of you may be familiar with the IPEC core competencies for interprofessional collaborative practice. And some of you may have noticed or been part of, indeed, the design of the updated third version of these professional competencies. They were published late last year in November. Briefly, these competencies are internationally relevant. They're endorsed by the WHO, among others. And their focus is on interprofessional collaboration. And indeed, if you think about back in 2010, when we looked at John Gilbert's paper for WHO, interprofessional education is very much a mechanism that drives interprofessional collaboration, which is the end result of what we wish to do to optimize healthcare for our population. So they have broken up interprofessional collaboration into 4 domains: values and ethics, communication, roles and responsibilities, and teams and teamwork. And today, I think we're going to focus a little more on teams and teamwork, because how do we go about assessing that in our traditional curricula? So IPEC defined teams and teamwork as the ability to apply values and principles of the science of teamwork to adapt one's own role in a variety of team settings. So if you think about that, that's a very action-oriented definition, i.e. application. They further break this down into competencies or elements. And you may be reading through this whilst you're listening to me. I'm not going to go through all of these. You may want to, at your own leisure, take a photo, screenshot, or go to the IPEC core competencies later on to read for your own reflection and learning. But I would like to highlight a couple of them, because I found those quite interesting and perhaps relevant to today's discussion. The third one is practice team reasoning, problem solving, and decision making. I thought that was quite interesting. So it's not so much clinical decision making as an individual, but it is this collaborative decision making. Also, thought that using shared leadership practices to support team effectiveness, we're starting to see what Bloom's referred to as the affective domain. Traditionally, we've been focused more on the cognitive domain of Bloom's taxonomy, but now we have more affective skills. And apply interprofessional conflict management methods, including identifying conflict cause and addressing divergent perspectives. I think that's a really interesting one. I don't know to what extent we look at negotiation, conflict management in our curricula, but I think that that's something that, well, at least I could benefit from. And I think many of us could benefit from as part of our learning. The second concept many of you may be familiar with is the Kirkpatrick model. This has been around for decades now. This was traditionally 4 levels. So I would probably like to introduce you to a revised or a deconstructed Kirkpatrick model, which has a few more levels as applied to interprofessional or to health education. And it's a way to evaluate whether learning has taken place. Traditionally, it was done for training, but here we can do it with respect to health education. On the bottom, you see learner satisfaction or reaction. And I'm sure many of us here, if they're academics involved in teaching, would be involved in being evaluated through various unit of study surveys or spot surveys of our teaching. But learner satisfaction to the knowledge or teaching is the base level of evaluation. The second is modification of attitudes and perceptions. Now, I find that interesting in that in this model, traditionally, Kirkpatrick had combined knowledge and skills and attitudes and perceptions. But here we're breaking it up a little bit because for those of us that have experienced reading research in interprofessional education, the vast majority of evaluation that takes place in interprofessional education is through use of scales that assess attitudes or perceptions. So I think people are familiar with the scales like ISVS or ripples or equivalent to measure how the students' attitudes or learners' attitudes. The question is that's useful, and I think that we've got a good evidence base now that interprofessional education can modify attitudes. What I'd like to do is perhaps move up the pyramid a bit more to look at whether learning has taken place. How do we assess that knowledge and skills have been acquired? And I'll focus on that today, but I acknowledge that we aren't all working in tertiary education. There's many of us here that are also working in the workplace through continuing professional development, looking at interprofessional collaboration in the workplace. And you may also be looking at changes in professional behaviour, in organisational practice, and indeed benefits in patient care. And that's some of the work that I guess I'm involved in around health services research. But today, let's look at whether learning has taken place and with respect to teamwork and thinking about those skills of teamwork. So I'm going to do a brief introduction of a activity that's led by Associate Professor Kelly Charles at University of Sydney. And this is around medication safety, or how might interprofessional collaboration improve medication management. So this is a micro-curriculum where students will do pre-work and they do preparation in their own professional domains or silos. They also get some introduction on medication safety and team roles in medication management. Medical students then will use their knowledge to prescribe medications for a very simple case study, which is quite protocol driven in terms of prescribing. And this is at an early stage of their curriculum with respect to prescribing competency. And they'll write some progress notes. Pharmacy and nursing students will then review individual medication charts, review the prescribing, and contribute in their roles within the medication management cycle to provide their disciplinary expertise. And then together in person in teams, they will perform a handover using ISBA. They'll review the charts and the progress notes. And then they'll actually together collaboratively prescribe or modify the original prescription medication chart. Then we review the charts, and what we've done over a few years is actually look at the changes in the initial prescribing versus the collaborative prescribing. So what we have here is a skill that we see individually and then collaboratively. If you will, it's analogous to people may be aware of the IRAT and TRAT in team-based education. Whereas that is MCQs knowledge, here we've got a skill. And then finally, we do a debriefing session where we look at those differences and how that may have, how team dynamics was encountered in session 2 and go through learning. So that's just one example. I'm sure you may have other examples that you've already delivered or planning to deliver, or you might be interested in working with others to deliver in both tertiary education or indeed in the workplace. And thinking back to it, how might we move or assess teamwork skills as we, from attitudes and moving it up to knowledge and skills evaluation? So here are the 3 questions that we're going to use in our breakout rooms. How do we currently assess teamwork in our interprofessional curricula? How can we better assess teamwork? And I want to throw in a 3rd one here. Who should be assessing teamwork? Should it be ourselves as learners? Should it be our peers as learners? Or should it be educators? Or should it be consumers? Or should it be an amalgam or diversity of modes? And how might we do that in interprofessional education?
Thank you, Carl. I think you've prepared us for our breakout rooms. May I ask you to go back 2 slides to the Miller's pyramid again?
You mean Kirkpatrick? Yeah.
Kirkpatrick,
like
sorry.
it?
Miller, Kirkpatrick, who's the boss? And I'm going to encourage people, if you think this might help you in the breakout room, to grab a screenshot of it right now. We're just trying to create a document for you unsuccessfully. So this is your moment to just do a quick screenshot of this before we pull you into the breakout room. You'll have at least one AIPPEN steering committee member or an ANZP fellow in the room with you to ensure that you have a rich discussion. And one group is going to also get Carl, lucky people, to get him to facilitate your conversation. Please, before you jump in to discuss one of those 3 questions, briefly introduce yourself to each other by stating your name, because we do like to pronounce our names correctly, where you work, and kind of what your interest or experience is with IPE, because that knowing your context and interest will really help us to understand your response to the questions that Carl has posed. We're hoping that 20 minutes is about enough time for you all to share your ideas and get to know each other. If you think your group is finished, you can come back to the main breakout room, and some of us will be there to greet you. When we come back, we're going to do some sharing, and we don't want just a recount of your conversation. So I'm going to ask the facilitators to be jotting a few notes, maybe in a Word document, of some insights or key sticking points that they can drop into the chat when we come back, so that all of us can see sort of the culminating or generating ideas that are happening in there. All right. So we really want to try and get ourselves, when we come back for the final 10 minutes, to generate some insights or further questions that you can really take away and chew on together. Right. Thanks everyone for coming back. We've still got a large number of people with us. If you were like me, a facilitator, you're probably still finishing typing up your notes and the insights. I'm going to ask facilitators to drop them into chat. And anyone from any breakout group, if you think you had an insight from the conversation that wasn't there when you went in the room, feel free to drop that into chat now, because what we'd like you to do is open your chat, take a look at the comments that are being dropped in there, and perhaps I will ask Carl to take a quick look at some of them and either pick up on an idea, or perhaps you might ask the person who posted it to elaborate a little bit if you think there's some detail missing for us to understand.
I might start by looking at Heidi's comment on observed behaviors. And that was one thing that we had in common in my group as well, that we're predominantly assessing attitudes and identities using validated scales. But I was excited to hear from Sarah, who is looking at conflict or role negotiation, and up in Lismore, in a rural environment and in professional case studies, and they're observing behaviours. Sarah's still looking out for a validated tool to structure the observation, but I think that looks like it's a step in the direction of assessing team, that conflict management competency or teamwork that for IPEC. So if anybody, I'll just add, if anybody does have a validated tool for team observation of negotiation or conflict management, if you could drop it into the chat, that would be fantastic. I think a few of us would be very, it would be helpful for many of us.
Thanks, Carl. I'm going to invite one member from the group that I was in, just to maybe elaborate a little bit more or tell us a little bit more about, I think it was Tim, sorry to dob you in there, Tim, of the idea of swapping in and out during a scenario and noticing when it sort of fell apart and the implications, this is Tim DeBoo, for the workplace setting. And then I think the epiphany, at least for me, because I work in a university setting, is how we really have to think of the fundamental elements that we would bring down there. Could you tell us a little bit more, please, Tim?
Sure, Megan. So this was building on a comment that was made by Leon regarding swapping in throughout a scenario or throughout a practice or a procedure. And essentially, we tried that. So my background is I'm an allied health educator, and we're a team of nurses, midwives, allied health clinicians and doctors at a regional health service. And so we tried to really push IPE, and one of the ideas that sort of came to some of our educators was that we swap people partway through a clinical deterioration scenario to see what would happen. And what we found is that even though people really, really knew what to do in those roles, and it was a code blue, and they work as part of a code blue response team, the scenario lost traction and it fell away really quickly. And in the end, the educators, and I wasn't actually the educator involved in this, but was involved in the debrief of this, was that it lost its momentum, and we really came down to the losing of what everyone's role was or what they were supposed to be doing, even though they knew what they were supposed to be doing because they do it out on the wards every single day. And I suppose the epiphany, or a couple of things there, was the importance of really maximizing psychological safety, so that they weren't concerned about making an error, and that it was staying just there. And we put that through a couple of different ways and said, well, we don't share our scenarios, etc., to try and keep it nice and tight. But I suppose the epiphany that Megan is talking to is that if we've got our clinicians out on the floor that do this every day and we swap them around in scenarios and we try a really big scenario, they can still struggle with making that happen, and it puts a lot of work on the educator. So how can we then expect at a pre-professional entry level or a student level for students to be able to manage complex scenarios? And that really maybe it's about, and not if I'm saying this right, Megan, it is about simplifying it and just taking elements of an interprofessional activity and sort of building that over time.
And perhaps someone who does a lot of simulation here might have an insight into how they address the need to be assessing the group rather than the individual. How do we do that? Does anyone have any insights, or you don't have to have the answer?
I just wanted to have one comment with Tim, and that was that in a student situation, if they were brought together, it would be a lot easier to accept that there was an error made or there was something which could be done differently rather than an established professional.
Thank you, Leon. Yeah. That might be worth exploring. Anyone want to build on that? Or Carl, is there another comment you'd like to direct our attention to?
I was actually looking in the chat, apologies, and I was just trying to reply to Dale's, and also want to reply to Sue's. But Dale's, I absolutely agree that it is one element, it's one domain, if you look at IPEC for in the collaborative practice. And because it is a holistic, large, multi-dimensional performance, it's how do we assess that? Because do we break it down into elements? IPEC's broken down into 4 domains, but with respect to teamwork, I agree, we focus mainly on communication, which is a separate domain to teamwork. And if we look at ICCAS, that's collaboration, attainment, which is self-reported, and ISBS is a socialization value scale. SPICER 2 also is self-rated. I would say that these are still in the attitudinal domain, and we're not quite there at looking at how teamwork actually functions, and that's something we need to think about how we do that. And observation is perhaps one suggestion earlier on. And with respect to what Sue said, do we even need to assess? I have an opinion on that, but not everybody shares it. I actually think that assessment drives learning to a large extent. But what we call assessment, whether it be formative or summative, whether it be self-reflection, metacognition, well, that I think is open, very much open. So that's more a question for the rest of us, because there's so many educators here today.
Thanks, Carl. I'm going to ask Heidi Waldron to elaborate a little bit on what she means by feedback as potentially a way to assess teamwork. Can you tell us a little bit more about that, please?
Well, actually, what came up in our breakout room was that sometimes rather than assessing, that feedback was a really important element related to the learning, but it wasn't necessarily embraced across multiple disciplines in the same way. So the first comment was related to student learning, where students were on placements and they have a number of different competencies, and then often the placement supervisors are providing more generalized feedback about communication, teamwork, and in some ways the shared attributes, but it may or may not actually be formally incorporated into the assessment criteria for each discipline. And also this theme that Carl pointed out then, often in the student setting, that assessment is a great signal about the importance of the learning and the driving the learning, but then also the fact that often teamwork capabilities received informal feedback in the workplace setting, and yet it's highly valuable. So it was almost that tension between, is it feedback? Should it be assessed? Or should it be almost a separate element in its own right?
Thank you.
Some rich discussion in our group about that.
Yeah, and I think there's a building thread within the chat, and it's around these tools that are giving, and I think there's a tension around giving students feedback as individuals about their individual performance, and then the idea of teamwork being something that exists when the group is together. And how do we get at that level? Is it always at the individual level? I don't think we've quite bridged that gap yet. I think we have time for Carl, for you to look at one more comment if you think it merits a little bit of comment, or if someone wants to put up their hand. I thought I saw a hand up and then it disappeared before we start closing and going to the wrap up. Carl?
Just I'll let
Oh, sorry, it was
speak.
our Kendu, I think, who put his hand up. So perhaps we'll let him ask his question and then we'll go to you, Carl. Our Kendu.
Yeah, and just wanted to share with you that we run an IP workshop with nurses and house surgeons, basically junior doctors and interns regarding episiotomy repair. So it's a hands-on skill. What we do is, with the outcome of what they actually have learned, we put it into a collaborative environment like a Padlet and others, where peers can give feedback and how they within the IP team have collaborated or not collaborated in that sense. What was the major issues in that sense? Sometimes what happens, for example, in a team, the doctors were quite dominant than the others. Okay, there were issues onto that, or what actually was really helpful in their experiences also in that sense. So that way we can both have peer feedback as well as the facilitators' feedback.
Thank you very much, Art Kendu. And I think this is addressing that, should we assess or not assess? Giving feedback formative to build skills is a form of assessment, but it doesn't always have to count for progression, big high stakes progression decisions. So is teamwork worth making it a big high stakes or not? Last word over to you, Carl, before we wrap up today.
Last word. Okay. I enjoyed the variety of conversations we had today. I think that this is, I think there is some agreement that this is a topic that is contemporary. It is a current topic in professional education. We have yet to establish a consistent approach to doing this. And I think that that is important as for accreditation purposes and also for transitioning or demonstrating the impact of interprofessional education on interprofessional collaboration. And I would also look overall to, I mentioned there's a couple of tools there. Team Steps has been well established in the United States. Elements of Team Steps are being implemented in practice across various health systems in Australia. That's something that you may want to look at because there are some tools that have been developed for that program. And maybe I don't know to what extent they've been applied to the tertiary education environment, but something we could look at. And I'll be hopeful that we can continue this conversation moving forward at AIPPEN. And I look forward to perhaps at the next ANZIP conference hearing hopefully some outcomes from this discussion and future discussions we have.
It might make a great pearl, wouldn't it? Because I think this is a thorny issue that we haven't really sorted out. So thank you very much, Carl. On behalf of AIPPEN and ANZIP, I'd like to thank you very much for being our guest today. Please notice I've dropped, we value your feedback because the goal of today's session was to encourage conversations among people interested in IP and to exchange ideas and share practice. I'm really hopeful that you've been able to get a new idea, meet someone new, have a new approach to try. Coming up, we've got a lot to offer ANZIP members, and if you aren't an ANZIP member, here's a benefit of membership. How do I teach with and through technology? A discussion of a framework for teaching physical examination in the digital age. A lot of us do physical examination in many different professions. In September, our next How Do I introduce structured feedback model into clinical teaching. So the examples will come from a final year surgical model, but I think you'll be able to find that the presenters are going to be multi-professional in how they pitch things. Next, please, Kendall. We are going to have one more IP AIPPEN session, so please pencil this date into your calendars, the 2nd of October. We haven't got our presenter finalized yet, but it will be a really engaging topic for everyone. So please, we will be advertising that closer to the date, but please pencil us in. And finally, once again, we really value your feedback. We design the sessions based on your feedback. We want to meet the growing interest in the AIPPEN community. So thank you very much. And once again, thank you, Carl and Heidi and Kendall in the ANZP office for supporting AIPPEN. We really appreciate it. And thank you all very much for spending an hour with us today. Goodbye now.